Good morning, everyone. Thank you so much for joining today. My name is Anna, and I am a team member working on the Trauma Recovery Grant. Again, thank you for joining us today to kind of get a refresher on the Trauma Grant and hear our updates. So this presentation will be recorded and shared along with the deck later this week. So before we get started, please mute yourself and turn off your camera to save bandwidth. Throughout this presentation, please place all questions in the chat box on messaging host and include your name and email address with your question. There will be time for questions at the end of the presentation, but I want to make sure I answer everyone's questions. So our agenda for today, we are going to start off with the Louisiana Department of Education, LDOE updates. Then we'll go through a trauma grant refresher, and then there will be time at the end for questions. So the first thing we'll talk about is submitting forms. So please make sure you have submitted the below forms. So your assurance to the LDOE, this form can be found in the provider guide. I've followed up with some of y'all, but I will send a follow-up for those who haven't submitted their forms after this presentation. Please also make sure that you or someone at your agency has submitted the payment form to the LDOE. This is a Google form. Submission of this form provides us with the information to input you and your team into our billing system. So after a submission of this form, you should then receive an email from Choices, who is our billing partner, with your username and password for our billing portal. This is how we reimburse you. And also please ensure that you or someone on your team have submitted your direct deposit and W-9 to Choices. So if you have any questions about this, please feel free to email me. Again, I will be following up with those who I am missing the above information from after this presentation. So please look out for an email from me if you think you might be missing something. So Medicaid, students enrolled with Medicaid will now be reviewed on a case-by-case basis. So the trauma grant can now pay for services that Medicaid will not cover. An example is this: is a student needs to be seen 2 times per week in your clinical opinion, but Medicaid only covers 1 session per week. The grant can then pay for that additional service. If you have a student who you're on the fence about, please email us at traumarecoverygrant@la.gov, and we can work it out with you. I know this is complicated, and we are here to support you in figuring out how to navigate this space with Medicaid. So the provider referral pathway, as a reminder, providers can directly refer students without going through their schools. All necessary paperwork and instructions can be found in the provider guide. There is an eligibility checklist that will need to be completed when enrolling a student who is not referred through their school. I will be diving deeper into this later in the presentation, but the provider guide has been updated to reflect this change. Feel free to look at page 6 in the provider guide for instructions and page 10 and 11 to check out the eligibility checklist. The most up-to-date version of the provider guide is located on the LDOE website, and I will follow up sending the link to this webinar and the deck, and we'll make sure to include the provider guide in that email. Surveys. So as many of you know, the Student Wellbeing Survey and the Trauma Grant Satisfaction Survey are reporting requirements of the Trauma Grant. Again, I will be discussing this more at length later in the presentation. The update here is the change in when surveys should be administered. We are now asking that each survey be given at the end of the first treatment session and again after 6 months of treatment, or at the end of the last treatment session if treatment ends earlier. The LDOE will follow up with providers when the 6-month timeline approaches to ensure this is completed. You do not have to worry about keeping track of this. I will have it on file to reach out to you. So LDOE contact. When emailing about the trauma grant, please message Trauma Recovery Grant at la.gov. The entire trauma grant team has access to this email, and it ensures your message will be responded to promptly. Also, starting in June, Ms. Tisha McKinney will be taking over as the Trauma Grant Project Coordinator. Her email is listed on this slide. You will begin receiving emails from her soon. I will be CCing her on things, so just a heads up, you will be receiving emails from Tisha McKinney. So if you have any questions or concerns about any of the updates, please email Trauma Recovery Grant at la.gov. It is spelled the way it sounds. And if you feel like you have a strong understanding of the grant program, feel free to jump off. The remainder of the webinar is a refresher session, more of a walkthrough of how the grant program works, including a review of the forms that need to be completed, payment instructions, eligibility criteria for students. So for those who have attended previous webinars and feel like you understand, what is going on with this grant, you are more than welcome to jump off. But I'm now going to start the trauma grant refresher. So the information shared in this presentation could also be found in the Trauma Recovery Grant Provider Guide. The guide is a manual and a resource for the mental health providers. It is intended to provide uniform practices to ensure fidelity and the implementation of the trauma grant. All necessary instructions and forms are included in the guide, and the guide will be reviewed and updated if policies and procedures change. So what is the trauma grant? So some background, the LDOE was awarded a 5-year federal grant by the U.S. Department of Ed to expand and deliver mental health services to students who are economically disadvantaged, academically struggling, and have experienced trauma. The purpose of the grant program is to enable preschool, elementary, or secondary students from an economically disadvantaged family who have experienced trauma and subsequently demonstrate academic, behavioral, or attendance, or other issues at school, access to trauma-specific treatment. The goal of the grant program is to increase student well-being, adaptive student behavior, school safety, and academic performance by supporting trauma-specific treatment. So, which students are eligible? Eligible students are any preschool, elementary, or secondary student enrolled in a Louisiana public, charter, or private school who meet the following 3 criteria. 1, previously documented or suspected trauma that is adversely affecting the student's academic, performance/progress, attendance, and/or behavior. 2, the student is identified as economically disadvantaged. And 3, the student cannot access public or commercial health insurance programs because services through such programs are either unavailable, insufficient, or unaffordable. So, economically disadvantaged. A student is considered economically disadvantaged if the student meets one or more of the following characteristics. Student is eligible for reduced price meals based on the latest available data. Family is eligible for Louisiana's Food Assistance Program for low-income families. Family is eligible for Louisiana's Disaster Food Assistance Program. Family is eligible for Louisiana's Program for Assistance to Needy Families with Children to assist parents in becoming self-sufficient. Family is eligible for Louisiana's Healthcare Program for families and individuals with limited financial resources. The student is an English language learner. The student is identified as homeless or migrant pursuant to the McKinney-Vento Homeless Children and Youth Assistance Act and the Migrant Education Program within the Elementary and Secondary Education Act. The student is incarcerated within the Office of Juvenile Justice or in an adult facility, or the student has been placed in the custody of the state. The third criteria, student cannot access public or commercial health insurance programs because services through such programs are either unavailable, insufficient, or unaffordable, is the most relevant criteria to your role as a provider. As will be discussed later, payment eligibility is a key component for a student to become officially enrolled in the grant program. The student must meet one or more of the below characteristics to qualify for payment under the trauma grant. So the student is uninsured, is economically disadvantaged, but is ineligible for Medicaid or other federal or state subsidized insurance programs. The student is insured, but trauma-specific services are not covered. The student is insured, but services are unaffordable because of a deductible or copay. The student is insured, but services are unaffordable because the cost of service exceeds the insurance cap. Like we discussed earlier, students enrolled with Medicaid will be reviewed on a case-by-case basis. The grant will be able to cover services Medicaid does not. If you have any questions about a student's payment eligibility, please feel free to contact us at the LDOE. So what is considered a traumatic event? Traumatic incidents may be those that occur either within or outside a school environment. Examples of a traumatic event may be bullying, including cyberbullying, harassment, experiencing violence such as school shootings, abuse in the home, community violence, physical, emotional, or life-threatening events that have lasting adverse effects on an individual's functioning and mental, physical, social, or emotional health, suicide clusters, death of a close family member, emotional neglect or abuse, family mental illness, homelessness, natural disasters, a parent deployed, a parent in jail, parents divorced, serious injury to self, sexual abuse, and student in state custody. This list is a representation, but not inclusive of all events that may be considered traumatic. So which providers are eligible? Providers eligible for reimbursement under the grant must be state licensed mental health providers, such as an LPC, an LMFT, an LCSW, an LIC, or a psychologist, provide secular, neutral, non-ideological services that are non-medical in nature and meet reasonable standards for evidence-based, best practices, promising practices, and/or evidence-informed trauma-specific treatment. And either you or a member of your team must have completed the Trauma Recovery Demonstration Grant questionnaire. If you have any questions about this, please feel free to reach out to me. So possible treatments. The trauma grant funds will pay for services that meet reasonable standards for evidence-based, best practices, promising practices, and/or evidence-informed trauma-specific treatment. This includes, but is not limited to, biofeedback, breathing training, EMDR, narrative therapy, exposure therapy, relaxation therapy, trauma incident reduction, skills training and effective interpersonal regulation, stress inoculation training, trauma-focused CBT, trauma-related cognitive processing therapy, and other promising approaches and emerging practices focused on supporting trauma recovery, such as youth PTSD treatment and preschool PTSD treatment. Those are just two examples. So where can you provide services? In keeping with Louisiana's new state law guaranteeing mental health service providers access to student clients on the school campus during the school day, pursuant to the local education agency regulations, services may be provided on the school campus at the service provider's office or virtually after hours. Services may also be offered in community or in-home. So how are students referred? Referrals for services can come from many different avenues. There is no wrong door. A parent may request services on behalf of their student. The student may be referred by a staff member at their school. The student may receive a referral through the Department of Children and Family Services. A service provider may identify a student who meets the eligibility criteria and is in need of services. This image represents the trauma grant school-based referral pathway. As you can see, your role in the school-based referral pathway begins once eligibility is confirmed by the LDOE. I will be going into more detail about your role in this referral process as the presentation continues. So once students are deemed eligible, parents will be provided with a packet filled with provider contact information. Families are instructed to select a mental health provider of their choice. Families will then contact a provider to make an appointment for a trauma screener, noting that they were referred through the trauma recovery grant. The family will then go to your office for the formal trauma screener. During this initial visit, the parent will sign the trauma grant consent form and complete the student payment eligibility form, which ensures that the services the students will receive cannot be paid for through other means. Both forms should be completed before you screen for trauma. If the student is eligible for payment under the grant, you will screen that student for trauma. If trauma is verified and the student is eligible for grant funds, you will begin servicing that student through the trauma grant. If the student is not eligible for grant funds, for example, the entire service can be paid for by Medicaid, you could discuss with the family what their next steps are. This could mean screening the student and billing through other means. Hopefully this will not be commonplace, as we will be doing our best to ensure payment eligibility beforehand. Determining trauma. Providers must use a good and reliable trauma screener when assessing for negative effects attributable to trauma exposure. You may use a trauma screener of your choice. Please consider using the trauma behavioral health screener. If you have not been trained in the use of the TBH and are interested in using this as your screening instrument, please visit the Louisiana Child Welfare Trauma Project website. It's latrauma.tulane.edu. On the website's homepage, you can find a link to a training video for administering the TBH. Under resources, you can click on resources for clinicians to access the TBH manual and screener. So throughout this presentation and in the provider guide, I will say initial visit. The initial visit is defined as the visit when the service provider administers the formal trauma screener. The forms that need to be submitted to the LDOE after the initial visit are the consent for trauma-specific mental health services, the student payment eligibility form, and if you are the one referring the student eligibility checklist. When emailing any documents that contain information about the participating students to the LDOE, you must use the subject lines outlined in the provider guide, and they are also found on the top of each form. So consent for trauma-specific mental health services. So prior to administering the trauma screener, parents and guardians must sign the consent for trauma-specific mental health services. The consent form informs parents and guardians about their right to privacy. This form only needs to be submitted once per child. This form, along with all other forms I'll discuss, can be found in the provider guide. So this is a screenshot of the form. It is essential for all service providers to give the parent and guardian both documents. Providers, please follow the submission instructions at the top of the form. You will scan and email the consent form to the LDOE using our secure email, trauma-recovery-grant@la.gov, with the subject line, provider name, _ consent form, brackets, secure. And when I mean provider name, if I was a provider, it would be Anna Novogratz _ consent form, brackets, secure. And I will go into more details about submitting forms later in this presentation. And just to let you all know, all parent and student documents have been translated into Spanish, Arabic, and Vietnamese. If you need an additional language, please reach out and we will get that translated for you. So the student payment eligibility form. So during this initial visit, parents and guardians must also complete the student payment eligibility form. You or a member of your staff should aid the family in completing the form. This form verifies that the student cannot pay for services through other means, such as Medicaid. If it's a regular psychotherapy session, Medicaid, if the student's on it, is more likely than not able to cover it. Students must meet all eligibility criteria in order to participate in the grant program. So this form is completed prior to administering the trauma screener. If the student is not eligible, the provider may speak with the family about billing through other means. Again, this should not be commonplace, as we will be trying our best to vet students referred to the schools prior to them coming to you for services. And this only needs to be submitted once per student. Here's a picture of the form. Again, please fill this out with the student's parent or guardian. This is kind of that final check to ensure that the student is eligible for grant funds. You may use your best judgment when filling out this form. Submitting forms. So you will email all documents that contain student information, as well as billing information, to our secure email, traumarecoverygrant@la.gov. When emailing any documents that contain information about participating students, you must use the subject lines outlined in the provider guide. That's just extremely important. We want to make sure that this information is, sent to us in a secure manner. So for example, when sending that consent form, you must use the subject line, provider name, _ consent form, brackets, secure. And I know I've repeated this multiple times already in this presentation, but I want to make it clear, please use those subject lines. So provider referrals. So if you know of an eligible student, they do not have to go through the school-based referral pathway. An example could be a family makes an appointment and you realize that the student is in fact eligible. Or a family might call and say they heard about the grant program and want to make an appointment. There is now a way for you to handle the referral process. This one additional step is completing the student eligibility checklist found on page 10 and 11 of the provider guide. This checklist ensures the student is in fact eligible for grant funds and provides the LDOE with enough information to enroll the student. You must complete this along with the additional forms as usual, such as the consent form and student payment eligibility form we just talked about. So here is a picture of the student eligibility checklist. The provider or a member of your team should walk through this checklist, and you should do so with the student's parent or guardian. As you can see, there is some overlap with the student payment eligibility form. That is okay. Please just complete both forms. On the second page, you must confirm that 1, you have that trauma screening consent form on file, 2, that the student was identified as having potential trauma, and 3, that the student met the eligibility criteria. And the staff member who completed the first page of that eligibility checklist must sign and date the form. This may be you or another member of your team. If you have any questions during this process, please feel free to email or call us at the LDOE. I will make sure to provide you with that information. As you can see that trauma recovery grant email all over this form. We are here to support you in this process. So what kind of data is the LDOE collecting? As part of the trauma grant, the LDOE will be collecting and tracking data. We will be collecting attendance, behavior, and academic performance data from our students, and the student well-being survey and trauma recovery satisfaction survey. Providers are responsible for obtaining the student well-being data and providing families with the materials they need to access that satisfaction survey. So we'll go over instructions real quick. So as discussed earlier, the student well-being survey and trauma grant satisfaction survey are reporting requirements of the grant. Each survey will be given at the end of the first treatment session and again after 6 months of treatment, or the last treatment session if treatment ends earlier. The LDOE will reach out to providers to remind them when that 6-month timeline comes up. Each survey can be accessed online via a Google form or as a paper form found in the provider guide. We would highly suggest using the online version, but if needed, you may also use the paper forms. So the student well-being survey, again, all service providers must ensure the student or parent has filled out the student well-being survey at the end of the first treatment session and again after 6 months of treatment, or the last session if treatment ends before 6 months. Please ensure the student or parent has completed the survey prior to leaving your office. You can even complete the survey with the student during your session if you would like. This form can be filled out online, on a smartphone or a computer. So please provide the student or parent with a student well-being access survey page. And if completing the survey digitally is not possible, please give the student or parent the paper version of the well-being survey. So here is an image of the Wellbeing survey as well as that access page. Again, we highly encourage students or parents to complete the survey online. They can type in that link or scan the QR code. So now I'm going to quickly go over the suggested administration process. So for students who are unable to read the questions, the provider or parent is to read the items and graphic representations of response choices and mark accordingly. This should definitely be done for pre-K and early elementary students. Elementary, middle, and high school students who are able to read should independently answer the questions about their overall well-being and progress. So if the student or parent and guardian chooses to complete the survey on paper rather than online, please print, scan, and email the completed survey to the LDOE using our secure email, traumarecoverygrant@la.gov, with the subject line, provider name _ wellbeing brackets secure. The survey is available in multiple languages to ensure equity of access. The Google form has been translated into 5+ languages. So please don't worry about that. Again, if you run into a client who speaks a language that you don't think we've translated anything into, please reach out and we'll make sure that happens. So the Trauma Grant Satisfaction Survey, all service providers must provide every family with the Trauma Grant Satisfaction Survey access page at the end of that first treatment session, and again after 6 months of treatment, or the last treatment session if treatment ends earlier. Parents will answer survey questions for pre-K and elementary students. Students who are 12 and older with parent consent will complete the survey on their own. Again, if completing the survey digitally is not possible, please give the hard copy version of the satisfaction survey to the parent. This will then be returned to the student school who is in charge of getting that back to us. Here is a screenshot of the satisfaction survey access page. Again, please make sure to print this out and show families, if need be, how to use the QR code to access the survey. Again, we highly encourage families to complete the survey online, but if they choose not to do so, please provide them with a hard copy version of the survey shown here. There are instructions located on the survey for the parent and guardian to read. A parent and guardian should answer survey questions for pre-K and elementary students. If the student is between 12 and 17 years old, parent consent is required. Please make sure to provide the families with both the survey and the signature page. And just like other parent and student facing documents, the survey is available in multiple languages. So updating information. If the information you submitted on the Trauma Recovery Demonstration Grant Mental Health Provider Questionnaire has changed, including a renewed license or a change in workplace, you must submit the following survey. Please note, when uploading a license, it must be an image of the individual license, such as an LPC card, not your agency license. And this link is also included in the provider guide, and I will include it in my follow-up email. The payment process. The LDOE has partnered with Choices Coordinated Care Solutions to facilitate the payment of providers for the trauma grant. The trauma grant will only pay for direct mental health services, so a missed treatment session and provider transportation will not be covered. So the vendor setup. Once you have submitted that billing form I discussed earlier to the LDOE, Choices will then add that provider to the vendor information portal, or VIP. Once this happens, look out for an encrypted email from Choices with your username and password. So that is how you upload your invoices and get paid. If requested, Choices will facilitate a training with new providers on how to use VIP. There's also a VIP user guide that can be found on the LDOE website and is also included in that initial encrypted email from Choices with your username and password. All providers are required to send a W-9 form and direct deposit form to ap@choicesccs.org. Again, this is how they reimburse you. So once Choices has received these forms, the provider will be able to start submitting invoices and receiving payments from Choices. all providers will submit invoices to VIP, and those invoices will be approved by the LGOE prior to payment. And choices process payments on the last business day of the month. So the LGOE will be reimbursing providers at a rate that is higher than Medicaid. So you can see those rates on the right side of the screen, and they're also found on page 21 in the provider guide. So where can you find these resources? I know I've been talking a lot about different documents, and all of that, all the updated versions are on our website. So how you get there is you go to louisianabelieves.com and then you click library. After that, you get brought to this library and you click family support. Once you arrive at family support, you should scroll all the way down to the very bottom where you will see trauma recovery demonstration grant. Under that tab will be all the necessary files. This deck, along with the recording, will be uploaded to this website later this week, and you will then see it right down there. Now, I'm going to take a few minutes to answer some questions. If you have any questions, feel free to unmute or put them in the chat. And I have one question that I will answer now from Miss Stacy. She was asking, are they referred to someone who is fully approved on your list of providers? And so when a student is referred by a school, they are given the mental health providers list that we created on Team Trauma Grant. Those are the providers who filled out that questionnaire, have sent in their assurance, and took those steps. So the only people who are able to service students referred to the trauma grant are those who have completed the steps that all of you have today. So right now, the families who are kind of going through this pipeline, and there are kids who are in this right now, they are looking at the provider list of the trauma grant providers. So all of y'all are on that list. And Julie just asked, is there a time limit on how long we can provide services to a student? And this is, just to let you all know, this is something we're still working through. For right now, there is no hard timeline. But you know, this is trauma-specific therapy sessions. You know, so it's not supposed to be like normal family therapy. So this is supposed to be a targeted treatment to address trauma. And I'm, here to have a conversation with you as a provider if, you think the student needs more than, let's say, 20 sessions. I'm here to have that conversation. There is nothing that is cut and dry, as every student is different. Every case is different. So this is something I've been thinking deeply about and would love to have more discussions on in terms of timeline. But for right now, there is no timeline.
Hi, Anna, this is Johanna.
Hi, Johanna.
Hi. I had a quick question, I guess, kind of related to this timeline. So for example, if this traumatic incident or event occurred